Thank you for virtually joining us today as we review the latest situation regarding COVID-19. I'm very happy to be joined today by Dr. Olivier Lo, who joins us today from Singapore. As well as reviewing the notable changes in the pandemic over the past week, Dr. Lo will take us through the medically led considerations organizations need to evaluate to ensure a safe return to operations. So first, Dr. Lo, over to you.
Thank you very much, Kayla. As of today, we are May 11. You know that we have seen about 4 million cases around the world with over 280,000 fatalities globally. All the 193 countries under the UN around the world are impacted to a various degree. As you remember, China was the first hit country with more than 84,000 cases, but now is primarily affecting the US and Europe. In the US, you are counting 1.3 million cases, whereas in Spain or UK, for instance, we are observing for each over 220,000 cases. And then they are closely followed by Italy, France, Germany. We're not forgetting Russia as well, with over 200,000 cases. There are nuances on reporting, as we know, because these numbers reflect to some extent the number of tests that these countries are doing and not necessarily the number of people being infected. But the main concern remains the African continent, where we start seeing some clusters in various countries. There is a major concern that local health authorities will struggle to contain the outbreak they are seeing there. The COVID testing as well is another controversial topic. Why is that so controversial? Is because you have a gap between the businesses that have started to use the test for COVID for staff management as part of their strategy for the return to operation. And at the other end, you have the academics and the WHO saying it's not accurate enough, don't use that for staff management. And so you see this big gap being slowly reduced with two things. One, we observe the immense innovation in technology, and especially around the COVID testing for the virus, the RT-PCR. It's now possible to have access to testing with a small machine analyzer at point of care. And so technology is there to make it more economical and accessible. The second big gap being reduced is because of the second generation of antibody rapid diagnostic tests that is coming out in a couple of months. And we will have tools allowing us close to 100% accuracy with this test. The next point for the update is the lifting of confinement, the de-escalation of the lockdown. As you know, Asia Pacific was first hit, and they are the first countries to open. China, as you know, including Hong Kong, Taiwan is well underway. We have New Zealand, Australia, last few days, we have opened up, as well as South Korea. And whereas other countries are preparing it for Europe, like Denmark, Germany, Switzerland, Australia, they have started already. And Spain, Italy, France, UK is in a preparation for gradual lifting of the lockdown. What we're really observing is that you everywhere have a strong intervention from the government authorities on how to approach this gradual de-escalation. So it's not a free, open rule. The businesses in the private sector are being told about the rules to follow. And we understand that it's a public health concern first, before the business, and how to have effective measures to alleviate the economic damages versus allowing a second wave of the disease.
Great. Thank you very much, Dr. Lo. So it's very clear that no matter whether your organization is preparing for or amidst the restart of regular activity, your main priority is protecting your people. So it'd be great if you could take us through those important protocols that they need to consider before or during that safe return to operations.
Yes, I think the first point that we're seeing is successful companies having a decisive planning. So it's not a plan like a document that you put on a shelf and it's pretty much useless and outdated. It's really the companies embracing this process as a dynamic movement, and they are always reviewing their planning all the time, being very flexible and applying many adjustments. The other focus, beside having a decisive planning, ongoing planning, is the operational execution. So we see a lot of buzzwords, right? We talk about customized protocols, we talk about playbook. Essentially, there are 5 pillars that are always there: the space of workplace, the knowledge of your workers they have to acquire, how you manage people, how do you organize the screening, and what equipment. Those are the 5 key points we always see. And the wisest planning execution is the simplest. So for instance, for the space, companies are looking at cleaning, disinfection, social distancing with appropriate signage and taping, where you can sit, you cannot sit. Also the ventilation flow, especially if you build, transparent plastics and physical barrier between your various desks. The knowledge of the people, you need to teach them how to put, the donning and the removing of the PPEs, the personal protective equipment, the social distancing or physical distancing, the review of what is the latest on COVID, how they can be infected, how is it infectious. Then you need to manage the people at the workplace. We call that cohort segregation, or team A, team B, the front staff versus the back office staff, and your commuting, the transportation strategy. When you have a lower prevalence of the virus circulating in the community, this is how your workers are most at risk to be contaminated, infected by COVID, versus catching it from home or from the workplace. Then the 4th pillar, the screening, you need to have some degree of screening for your workers. So it's not necessary, or it's no longer the face-to-face with the doctor. You can have a virtual health screening questionnaire. You do want to screen for your high comorbidity people. We call that vulnerable people. And you can even organize that through your providers, or SOS we're doing a lot of telemedicine, teleconsult. The last piece is the equipment, of course, personal protective equipment. We're talking about masks, gloves, goggles. Not everyone will need them, but if you implement screening at the door of your workplace, you need to protect your people as well. You need to have equipment for disinfectant, for the hand hygiene, of course, the thermometers with the handhelds, and the pulse oximeter as well. So all these are quite important. They may play a big or smaller part depending on the type of business. As you know, not all the workplaces are the same.
Great, thank you, Dr. Lo. It would be great if you could now share a few examples of how we've supported organizations along that de-escalation and safe return to operations, especially we've seen in some of the countries that you mentioned previously.
Yes, we've done that a lot in Asia for more than a month, and we're extending this type of service now to Europe, North America, Latin America, African countries as well, although they're thinking about it, when we are approaching the escalation, but they are more preparing for the escalation. 2 types of industries I think are quite representative. One is the energy sector, and the second one being the hospitality and retail. On the energy sector, the oil and gas, we see the management focusing a lot on protecting the rig offshore, the rig platforms at sea, pumping oil, and protecting these assets against COVID-19 at all costs. If an outbreak, occurs on board, it would be a big disaster for these companies. Why? Because you have a high risk of shutting down the entire oil production for the rig for quite a while. At the other end, you have, for instance, the hospitality and retail, where all these planning elements we discussed are focusing a lot more on reassuring the employee as a responsible employer. So the duty of care, or how to prevent and protect the vulnerable population, as well as reassure their customers and the clients visiting the workplace on their site. And there is a great emphasis on communication to demonstrate how safe the workplace is for their visiting customers.
Thank you very much, Dr. Lo, and thank you everyone for joining us today for our update. To learn more about how we can support your organization in a safe return to operations, please do get in touch. As the situation continues to evolve, please do continue to review our up-to-date information, advice, or assistance regarding COVID-19.